Hi guys, BreeAnn Allred, physical therapist and pelvic health specialist. We're going to be talking today about prostatectomy surgeries. Now, I would recommend if you are going for a prostate surgery, and hopefully are able to find this video before that, getting some education and starting some pelvic floor exercises prior to surgery is very beneficial. Oftentimes, males with prostate cancer will have to have a prostatectomy or a surgery to remove their prostate. Now, my role in supporting these individuals is often related to, as they remove the prostate, they remove a portion of the urethra, and depending upon how extensive the cancer is, they may actually have to go in and remove the internal sphincter of the bladder. Now, both of these two issues, as well as some damage that occurs to the pelvic floor muscles during this surgery, can lead to problems with urinary leakage for males after these surgeries. This can be very debilitating for males and very much a problem for their mental health and for their sense of well-being. Now, starting some pelvic floor exercises prior to surgery is very beneficial. Muscles that haven't been interrupted from a surgery are much easier to find, so then you would have a sensation of what you're looking for in your body after surgery. So I would recommend that you refer to my video regarding male pelvic floor strengthening and how to localize those muscles to be able to start that process. Now, after prostatectomy surgeries, oftentimes males will have a catheter in place. In fact, I think always they'll have a catheter in place for about 10 days to 2 weeks. Once the catheter is removed, that would be the time frame when you would start working these pelvic floor muscles. We don't really want to be working them before that because everything's working to heal at that time frame, and we want the catheter to stay in place and do its job. So once the catheter is removed, that would be the time frame when you would want to start doing these pelvic floor exercises. You would want to be doing them as far as the strengthening protocols that I've also referenced in an earlier video, that you could then look at and reference to really start to see if you can get these repetitions in each day and start finding those benefits for strengthening the pelvic floor. In incontinence after prostatectomy, the pelvic floor has to kind of up its game. One, it's been injured, but two, it is now losing two natural backstops that the body is used to having for urine. One, you've got that internal bladder sphincter, which will be gone, and you've got the prostate, which will be gone. And so now the pelvic floor has to really up its game to step up for the loss of those other two backstops. And so you may not have had a weak pelvic floor to begin with, but now you're asking it to lift more or to do more work or to function at a higher level. And that requires kind of upping your game. Think of a high school player versus a college player. You're gonna have to invest a little bit more in order to get better at what you're trying to do. So working these pelvic floor muscles can be very beneficial for helping with incontinence or urinary control following prostatectomy.